How unsafe is a given emergency room right now fighting this pandemic?
Well, good morning. It's across the country, different emergency departments are facing different levels of numbers of patients who may be presenting at this time. Many of the emergency departments, though, have been preparing for this time. And additionally, with many of the social distancing efforts that our citizens, our friends and relatives have been adhering to, that has helped to decrease the number of patients seeking care through emergency services. Also, as our colleagues in some of the outpatient clinic arenas and others are able to go to telehealth screening and care, that is helping to ease some of the burden on the emergency departments too.
What have you learned through this crisis? I mean, the images that we see of nurses in battle gear, essentially fighting off their own infections and the risks, many nurses dying, certainly many, many nurses ill as well. What have you learned so far, and what can you do about it in the coming weeks?
Well, we've learned for sure that caring for each other is paramount. And I mean that in both the physical sense as well as the emotional sense. So physically speaking, of course, it is certainly about personal protective gear. That's very much been front of mind and front in the media. It's also about proper donning and doffing of that equipment. And having individual safety officers, others whose sole job is to watch and coach and make sure that we are actually doing what we are supposed to be doing and not being distracted perhaps by other things. And our team, which comprise certainly of nurses and doctors, but also respiratory therapists, pharmacists, our pathology friends, many, many, many people out there on the front lines right now. And it's very intense. It's grueling work, and having the chance to support each other for our social work teams, our resiliency teams, our chaplaincy, et cetera, to help buoy us through this storm so that we can continue to do the great things that we're doing.
Dr. Patch, hello from London. I know here in London, a lot of NHS workers, I think about 1 in 4 nurses are at home with themselves symptoms of COVID. Until we have a vaccine or until we have medication that works, what is important for the nurses apart from protective gear? Is it antibody testing so that if someone has the symptoms, finds the antibodies, they can go back to work safely?
Well, certainly that's what we are hoping will be quickly available to all of us if we are able to do serologic testing to identify those who have antibodies and can potentially return to work quicker. That is one way, and we're very hopeful for that. Of course, it would also, it would make sense that we would have to consider also the physical impact that an individual is having, right? I mean, it would be challenging to go back to work if you're, you're still having severe symptoms. And of course, the social distancing. Of course, hand hygiene, 20 seconds at least, washing your hands or using at least 60% alcohol rub solution. Those are really critical. Masking.
Well,
sure.